So next I would like to discuss the Mckenzie treatment plan for neck pain. So the first step in the process is that we want to look at the patient's posturing. So we want to look at how they're sitting at their desk every day or how they're sitting in a chair at home. We also want to be looking at their sleeping postures as well. So to begin with the sitting posture, the man to the left is having a slumped posture with a forward head, and the lady to the right has a posture correction roll for her lumbar spine in that she has a nice C curve right in the middle of her lumbar spine, and that's what it should look like. You should have that C curve, and you also should have your neck over your shoulders. So I always tell patients to make sure their ears are in line with their shoulders, and that's your proper neck posture. And that'll help with anybody that's having some sort of neck pain. Also, for sleeping postures, you want to make sure that your pillows are not too high or too low. So you want to make sure that you're having a nice C curve as well in your neck to make sure it's being supported. So these are just some of the Mckenzie posture correction tools that are utilized for patients with neck pain. So that we have the cervical roll, which is used for a patient that's in sleeping, when they're sleeping, and it helps to keep that natural C spine, the C curve in their cervical spine. And then for the lumbar roll, same thing with the back. You put a lumbar roll right in the middle of your back, and that helps to support that C curve for when you're sitting for long periods of time. So before you're doing any of the self-treatment options that I'm going to be showing you today, you want to make sure that you are not having any of these symptoms, because if you are, then it's recommended that you see your physician or your physical therapist before beginning any sort of exercise program. So just a list of some of the symptoms you want to look for if you're having dizziness, drop attacks, double vision, difficulty chewing or swallowing, confusion, headache, nausea, vomiting, arm or hand weakness, or numbness in the mouth, then you want to make sure that you are getting checked out by your primary provider to just make sure that there isn't anything else more serious going on. So I'm going to highlight the exercise progression for a patient with a posterior derangement. So like I said before, most patients that have neck pain, they fall into this derangement category, and they are considered mostly posterior derangements, which means that the jelly in the donut, like I talked about before with the disc herniation, the jelly is coming out of the back of the donut. If this is the case, then we will first give a patient chin retraction exercise for their home exercise program. So first, you want to be sitting in a chair with a good posture and possibly with a lumbar roll in place in order to hold that proper posture. Lisa is going to show us what a proper chin retraction looks like. So Lisa, I'm going to have you keeping your eyes straight ahead, and you're going to pull your head back into a retracted position as far back as you can. Perfect. So you want to make sure, one of the most common compensations we see is we see patients tilting their head up or down, and so you want to make sure that you're staring straight ahead. So we usually have the patient do about 10 of these, and we have them do them every 2 hours as long as you're able to tolerate it. So as long as the pain is not going further down your arm or getting worse further down your arm, then you can continue. If the pain intensifies in a more central location like your neck, then that's okay. You can continue as much as you can tolerate. If you're getting more severe symptoms, then you should try this retraction in a lying position or see your physical therapist for further instructions. So the next step in this progression process for a patient with a posterior derangement would be a chin retraction with overpressure. So this is something that we do when a patient's symptoms have plateaued. So what we want to do again is we want to have the patient perform the chin retraction exercise. So Lisa's going to go ahead and perform the chin retraction exercise again. Perfect. And while you're back at that end position, Lisa, I'm going to have you put 2 fingers on each side of your chin, And you're going to go ahead and press all the way back as far as you can. Perfect. And then relax. So I would have a patient do 10 of those and see how they would respond to this activity. As long as, again, the pain is not getting worse in a location that's further away, then she can continue this exercise. If it's getting more and more severe, then again, see your physical therapist for further instructions. So again, if the symptoms have plateaued, then we have another addition to this retraction program. So what the patient would do at this point is add some neck extension into the program. So we start off, Lisa, with the chin retraction with some added overpressure, and then extend your head all the way back as far as you can go, and then give it a little bit of a wiggle like you're saying no, and you're going to do about 2 to 3 wiggles and then bring it all the way back up. Perfect. So I would have the patient perform 10 repetitions of this exercise every 2 hours as tolerated. And again, as long as the symptoms are not getting worse in the arm or hand or in a spot that's further away from where their original symptoms were, then they can continue with this exercise. If they're having a lot of pain with this, then you can also try it in a lying position. And you also want to progress these exercises accordingly and make sure you're not rushing through the exercises. Again, if the symptoms get more severe, then you would want to see your physical therapist for further instruction. So if your pain is still not responding with this progression, then you would want to try a different exercise. So Lisa, I'm going to have you go ahead and turn around and face the camera. And what we're going to do next is a lateral side bending exercise. And this could be happening, this could work for a patient with a derangement, but it just means that instead of the jelly coming out the back of the donut, the jelly could be coming out of the side of the donut. And this is considered a lateral derangement. So the exercise progression that we take at this point is that you want to bring your ear to your shoulder of the side where you're having pain. So let's say Lisa is having right-sided neck pain. So Lisa, what you're going to do is bring your right ear to your right shoulder. Good. And then bring it back to neutral. Perfect. If you're able to tolerate this and are able to progress further, then we're going to give it a little bit of overpressure. So you're going to, again, bring your right ear to your right shoulder and give it a little bit of a pull with your hand. Perfect. And then relax. So again, we're going to have the patient do 10 reps of these every 2 hours as tolerated, as long as the symptoms are not peripheralizing down the arm. And as long as the symptoms continue to centralize, I would have the patient do this exercise. So once the pain has hopefully abolished at this point, and you're no longer having the same pain, the final steps are to restore range of motion throughout. So we want to make sure that they're not just getting the retraction range of motion, that they're also getting every other range of motion. So extension, flexion, side bending, and rotation. Rotation is especially important because this is something that we do every day that we don't even realize that we're doing. So we want to restore normal function throughout the neck and maintain this new flexibility. So even once you are no longer having pain, you still should be doing these exercises in order to maintain your flexibility. You just wouldn't have to do them as often. You also want to make sure that you're maintaining good posture when you're sleeping and when you're in a sitting position, especially if you work in an office where you're constantly sitting all day long. You need to be really paying attention to the posture in your neck as well as the posture in your back. If none of these exercises help, there are other options for treatment. So see your Mckenzie trained physical therapist if pain is not subsiding with this treatment. Finish? Should I have like a finish slide?
That's okay. No, because you took a long time. It's fine.
Okay. I was like,
you were like, will it be something after that?
I kind of stepped all over the CDs a little bit, so I hope
you move.